Good evening to you. Good evening to you. Today we have to look at a pretty serious topic, the 7th day of COVID. And this is my clip number 247. I'm Dr. Lalith Mendis, and we know we are in a very serious time in our nation, and we all need to pitch in and help each other. It is in that context that I am formulating my thoughts today. It's not a happy environment, but we must do our best for those whom we have known for a long period of time. So I want to do the 7th day, and then I want to do when you come home from. So we must stop that somehow, take that stance. And here are some things about the 7th day. You have to watch the 7th day, and this is the proper way to do the oximeter breathing test. Always from day 1, take a deep breath and see whether you can count to 10. 1, 2, 3. So that clinical test is always very good, gives you confidence, and it also improves your breath. And also always do breathing exercises like that. And while on bed, you must also tighten your muscles. You are asked to bed rest as fever gathers up and lung may get involved. And many get diarrhea very early, a very severe diarrhea. Now I have sent documents about the first 6 days. I have sent documents about the 7th day. Today I am having a new document about the recovery phase. At each stage I have done in detail what you should do. If you have not got the clips before, you must read up 244, 245, 246 clips. They are available in Sinhala also. I am Dr. Lalith Mendis, and if you want any more docs, please send a WhatsApp to +94 76 313 4800. Do not telephone me. If you are in Sri Lanka, it is 076 313 4800. Then I will send you all the documents that are necessary to help yourself, a family member, a neighbor, and so on. We must help each other. We must take hope. We must stop death. Keep saying those 3 things. We take hope. We stop death. We help each other. Stop looking at more and more COVID news, because you will only get depressed. Attend on the things at hand. Have a thankful spirit, thanking what you have. So how to take home care without you getting infected, I have done it in 245. Very quick run up on the 7th day. So the fever may rise again, onset of diarrhea may come again, headache may come again. This means you are going into that second phase, which is the immune phase. First phase was the virus phase. It is in the second phase that lung gets involved, and a thing called cytokine reaction happens. It's an immune reaction where cells of your own body begin to fight you. So that is a serious condition. It happens passing the 6th, 7th day. You have to watch it. Even if you have fever coming down, you feel very well, you must keep your oxygen check going, and you must do bed rest. Eat well, enough fluid, especially if you have diarrhea. You must take enough Jeevani. Milk tea, hourly even helps, because tea also has quercetin that helps in natural immunity. You must have a good night's sleep and do all get that part well. So what do I mean by the watch your lung? 1, do the breathing exercise I told you. Deep breath and start counting to 10, 3 times a day. Any time that you find you can't count to 10, that means your lung is getting involved. Other thing is, if when you're on the 4th, 5th, 6th day, with the pulse oximeter, of course, on your index finger, that gives you the pulse. You must know that if the pulse is rising, though you feel okay, that means either you're dehydrated or your lung is getting involved. I repeat, if the pulse rate is going up, though you feel okay, it means either your lung is getting involved or you're dehydrated because of the diarrhea. So you must take enough fluid all the time. Then sometimes though your oxygen is going down, increasingly you are not observing well enough. It is called happy hypoxia, which is not a good state, where your oxygen is going down and you don't know. That's why when you're on the 4th, 5th day, you must particularly do this. Keep doing your breathing exercise. Particularly do this. That is, sit, stand for 10 seconds. Sit, stand up, sit, stand up, quickly as you can, of course. And then with your pulse meter on your finger, you must finish the 10 seconds and wait. Because you will find the pulse meter reading goes down, picks up, but once you stop the exercise and wait for 3 minutes, then only you will find if it's actually going down, it will go down at that point of time. So that is so wait for 3 minutes after you stop the exercise. Don't exercise all the time. Then if the pulse oximeter oxygen reading is down to 95, below 95, you have to get in touch with the hospital system. The government telephone number is 1390. Contact it. PHI has to help you to get into it. Yes, so as you know, many hospitals are full, even in the private sector, but you must do your best to look after yourself. So that's about this all-important oxygen on day 7. Then rise of fever again, onset of diarrhea, headache. Then someone has to get you to do a full blood count. In the full blood count, if you find your neutrophils going up and your lymphocytes going down, it is not a good sign. Neutrophil is N, lymphocyte is L. That is, the total count remains just 9,600, say. That's within the normal limit. But the N goes up, L goes down. That means your lung is getting badly involved. It may be not only the lung, in the gut also. When this, in your alimentary canal, when the diarrhea is going on, a system called interleukin system, particularly interleukin 6, gets aroused or increased, and it begins to get your cells to fight your own body cells. This is why you must take vitamin D from the beginning. 60,000 a week is a good thing, and zinc also. And then of course there are early molecules that can be taken to stop the virus spreading inside you. So those molecules must be taken. They are available in Sri Lanka. 2 kinds of molecules can be taken and must be taken. That greatly helps in preventing people running out of oxygen. You don't get hypoxia, you don't die if you take the early molecules. And this kind of talks, you don't allow me to speak about it because this clip will be taken off if I mention. So if you want to know anything more, I have written an academic article to the College of General Practitioners of Sri Lanka. I am Dr. Lalith Mendis. My last substantive post was as Head of Department of Pharmacology in the State Medical Faculty. So College of General Practitioners Sri Lanka has published a management, that document I can send you if you send me a WhatsApp number to 076-313-4800. Please do not telephone me, I will not answer. I cannot, So this is about the breathing thing and how to watch after your lung at that stage. Then pulse rate can go up when your oxygen is down or when you are getting dehydrated. Pulse rate above temperature signifies a cytokine involvement. That is to say, normal pulse rate is 72. Usually for every degree of centigrade, pulse goes up 10. So if its temperature is 99 and your pulse is 82, that's the temperature. If your temperature is 100 and your pulse is 92, that is because of the temperature. But if your temperature is 99 and your pulse is 100, there's something else wrong, which is called cytokine involvement and reaction. So what you should do is, as a physician, the doctor who's looking after you, even if you're in home management, from day 1, you must do a full blood count. That will look after your platelets also. And you must do a thing called the CRP, C-reactive protein. If the C-reactive protein is under 15, normal should be only less than 5, but under 15 it is not too bad. But if the C-reactive protein, CRP, jumps from one day 15 to next day 115, you are in trouble. Anyway, most doctors will say if the CRP is going up above CRP is going up above 25, you have to get admitted because your lung or the gut are getting involved in that thing called the cytokine storm. So those are bad parameters. So you watch them from beginning to see if they are going up. So one more time I had to tell you, if the total blood count is just 9,600, but neutrophils are increasing, N is increasing and lymphocytes are decreasing, that's not a good sign. N goes up and L goes down. So N to L ratio, if it's going up beyond 5.4, you must quickly get a doctor to admit you. Yes. N over L ratio must not go above 5.4. There are other things that are medical, that maybe there's a thing called LDH that goes up, ferritin that goes up, so you must get your doctor to check these things. I have 2 full documents on these procedures. If you have still not got it, you can get it by sending a WhatsApp number to that telephone call. Then continue promethazine 25 milligrams BD. Continue bromhexine syrup. It's an old syrup which originally was derived from Adatoda. It has a good effect on the lung. Then if lung gets involved and oxygen drops, I told you, you must keep a check on it. You have to get to hospital. Then the Oxford Stoic trial. If you have coughed badly, Oxford Stoic trial bill has recommended budesonide. Budesonide is an old inhaler that you use for asthma. Budesonide. That inhaler is available all over Sri Lanka. When you are getting the cough from the beginning, you must take 2 puffs in the morning, 2 puffs in the evening. That delivers 200 micrograms per puff. That keeps the lung condition down. Then you also need to know, if you drink cinnamon tea, much research has been done on it. It is called Ceylon cinnamon aldehyde. The cinnamon tea will be also good to keep your lung molecules attended or resolved. So if you take the vitamin D from the beginning, 60,000 for a week, then the pro-resolver molecules keeps the lung reaction down, which is very important. Yes, that's a lot about the 7th day. Now I want to read something. Look at this phenomenon. Look at this phenomenon. Diminished will be the man who trusts in mankind. Just listen to this. And makes mankind his strength, whose heart turns away from the good shepherd. So we have trusted what people have done absolutely, and this virus has been made by man, that is fairly clear, and it is causing terrible trouble in the world. So this is a time for you to think of, now I want to get on to what you need to do after when you're recovering. Your lung has gone through the trouble, but good physicians have treated you. Mind you, I need to tell you, when the lung is getting into trouble, there's a thing called triple therapy to give. Normally you don't give it from home. You have to get into a hospital. Then you will be given dexamethasone and another, that is to stop the cytokine inflammation, immune inflammation in the lung. You will be given an antibiotic, because that is so that no other infection gets into you, and you will be given a certain drug to prevent the clotting, little bit of blood clotting that goes on in the lung or in the gut. So you don't have to despair. That is, there is a treatment available. At the same time, if you treat yourself early with these early molecules that can stop the lung reaction, it's by far better. Yes. The lung reaction needs to taken care of early before it happens. So this little verse says, when we have trusted in ourselves so much and not heeded what the Good Shepherd has given us, he said, where if we know him, he will attend on our daily portion, which is called green pastures. He said, you will have enough, so you will not fight with each other. So this is the time to give up our fights. Secondly, he said, I will lead you into all that you need to have, not what you want to have. He called it the next waterhole, next resource, he will lead you. 2, he said, when you are down, you need every day an hour of restoration. I have done this for parents and so on, children, how to do it at this time. Please refer my former clips. There is the 247th. All of these are available in an app called Golden Nuggets. You can get it, download it free from Google or Apple Store. Dr. Lalith Mendis, Golden Nuggets. All these scientific talks are there. So the diminution that comes to man, for he will be like a bush in the desert, will not see when prosperity comes, when good comes, but live in waste places, in a land of salt. But blessed is the man who trusts in the good shepherd, who the good shepherd looks after him. He will be like a tree planted by water, extending his roots by the streams. He will not fear when the bad days come. Your leaf will be always green, and you will not be anxious in a year of drought or COVID, nor cease to yield fruit. So you will always keep yielding good fruit. The problem of man is that his heart is deceitful. Whatever he does is always right. This is the trouble that man gets into. So here's a little summary of man's predicament. We think what we do is always right. Someone is saying, due to your advices, almost all of my patients recovered without complications. I am very grateful for that. Thank you for telling me. Many of my students are contacting me, even my colleagues. Few of my teachers also have contacted me on this problem. So as I said, help all you can, hope all you can, stop dead. Got the three things? Help all you can, hope all you can, stop dead. So the Good Shepherd said, in this terrible time, he will appoint a place of restoration or reset, of knowing that man has come to the end of man, which means the Good Shepherd will have to help, and we will seek his help when we have come to the end of ourselves. It's a very sad thing, but it was coming, and it has come in this tragic way. We thought it will come through the sexual perversions. We thought it will come through the family breakup, all of which is bad, but we never thought it will come through a health issue like that, engineered by man. Yes, so this is the sad situation. So the Good Shepherd says, in this trouble, it is called the valley of the shadow of death. In this trouble, he will lead us in paths that will be right for us every day. So this is a time like that. Once upon a time we planned our annual holidays. Now upon a time we can't plan our next day. We are looking after actually every hour. If you have looked after a COVID patient at home, you know every hour you are anxious. You are wondering in the night, will she wake up okay? It's a very difficult time. But Good Shepherd says he appoints hour of reset to get back to what? That you will see the good that is there for you. And you will say, thank you, thank you. Every day you will say, thank you. Before sleeping, you will say, thank you. Before getting up, you will say, thank you. Then he says, he will anoint our head with oil and give us a cup that is enough for us. And that it's a cup that will overflow, meaning from what I have, flow over to another's help. Overflow. Enough for me, overflow, meaning always be ready to tilt your cup to help someone else. So head is looked after, covered, protected, and the cup has enough to give another one. Then he says he will appoint paths that will not go crooked, that will not sink, that will not have boulders over which you fall over. And the Good Shepherd said that path will always lead you to, how did he say it? To that you will see good coming. Blessed is the man who trusts in this Good Shepherd, and you will see good coming when it comes to you. It is coming. Good is coming. That's where this path is. You will be in a green place, not anxious in drought. Yes. And you will have always a life of good fruit. That's the promise. So he says he will attend on our table during this adverse time, the people who should be in your life. And then that's how his suggestion, his proposition. Now we want to get on to after recovery. So share, if you want this document, you can say, please send me 7-day document, please send me recovery document, and the first document is first 6 days. Yes. It has practical details and some medical advice that some of it you need to check with your doctor, obviously. So this is the recovery document. After hospital discharge, or if you didn't have to go to hospital, it's a wonderful thing. Then what do? You are still feeling very weak. You feel as if you have run a marathon. So after the first 14 days of the illness, another 14 days absolute bed rest. Only toilet is allowed. Watch your oxygen saturation and the pulse rate for further few more days. 2. While on bed, even in early days, tighten your calf muscle, tighten your thigh muscle, tighten your arm muscle, especially if you are of age. Don't be just languishing on your bed doing nothing, because you must prevent blood clotting. That's a risk of blood clotting. Then 3, if pulse rate is high anyway, because if you have had diarrhea, you must keep drinking Jeevani many days after that and increase drinking of fluids. You have to watch not to take sugar at all. That is important. Then I told you, when hypoxia, you don't feel it, your pulse rate still goes up. So you have to be careful of a pulse rate that keeps high. After triple therapy, which is done in hospital, you may get a little gastritis. You have to take a thing like Gaviscon. If you feel the gastritis, it must be attended on, because rarely people have bled from their stomach. Physician may continue antibiotics. Take them carefully at home. Bromhexine syrup can help in lung resolution. Then physician may continue the budesonide puff daily at home. Absolute bed rest even after coming home, at least for another 14 days. You need to take bed rest. Prayers, songs, cheery atmosphere, others reading to you good stories will help. With moderate or severe lung involvement, 1 month rest, no going to work. Yes. Physician needs to do a follow-up. Some people get sweating, their metabolic rate gets affected, so they consume more calories in their system, and then heart rate also keeps high for a while, and that needs certain kind of treatment. So you have to see a quick review with your physician soon. Continue vitamin D, zinc and vitamin A. Lots of tea is very good to drink. Then garlic curry, kottamalli helps. Some people have found cloves, chewing cloves and cinnamon during the lung stage, there is an effect of these spices. Some major research has been done. It is called the Ceylon cinnamon aldehyde, that is far as the cinnamon goes. Then there are early molecules that can be given to contacts, your near contacts. It's an old molecule that was given for children having filariasis and scabies, extensively used in 1975. That molecule earned the Nobel Prize. That can be given to your contacts to prevent them getting it. It can also, very recently, NMRA in Sri Lanka is giving recognition for it, approval to get it down, but it is available in pharmacies all over. Then if you are a frontline worker also, that this is available to keep you safe as well. So these are the things that you need to know. Thank you for joining with me. So one more time, you look at your life and say, life is like a plot of land. In the plot of land, there are stony places that look at it and say, let's say there's 1 acre, and you find only quarter acre is doing well. What's wrong with the others? Some places it was once upon a time well, now it has become infertile, fallow ground. What happened? Bad relationships, getting angry with people who helped you. That's what fallow means. It's once productive relationships now gone down. Then there are other places where it was okay for a while, but underneath was stone. So it's a heart problem, heart problem. There are other places it's marsh and mire. It's a marshy, muddy thing, and a low place in your life, and it always pops up. We need to fill up that low places, and we have a promise that the Good Shepherd will fill up low places. And then there are other places which could have been, was doing well, but now some situation happened and it has got all thorns and things like that. The situation somehow it did not do too well. So it didn't do too well, and it became, more thorns came up. Finally, there are some other places in your life, it's like the roadside, always busy, this, that and the other, and ravens of the air come and do dirty, and they remove the good things out of your life. So check out these places. Small fertile ground. How do you increase your life harvest? Increase the amount of area and relationships in your life. for the sowing of a good seed. Small fertile ground is not enough. Increase that amount. So it might be marsh, underneath might be rock. You might have got into thorny things, or you might have just have the wrong kind of relationship just entering your life like the ravens. Always a fight, always external influence more than your internal growth. So it's a time to watch you inside as much as you watch COVID. So the cross story is this, that all what we did wrong, there was a hope of righting it. R-I-G-H-T-I-N-G. What human beings do is, all that goes wrong, they write it down in a journal or in chits. You owe me this, you owe me this, even between husband and wife, you owe me this, or with daughter and father, you owe me this, you owe me this. But here's a chance not to write, not to do W-R-I-T, but to do R-I-G-H-T-I-N-G. That's what this cross story is. What went wrong was put right. We were given a positive. These days a positive report is not a good thing at all. PCR positive, it's a terrible thing. But here the negatives are removed and it can be put right. So this is a time writing what went wrong. That means not W-R-I-T-I-N-G. No, normally we do that. This is R-I-G-H-T-I-N-G, for yourself, for another, writing what went wrong. Don't keep it to the next day. This is what Good Shepherd did on this cross thing. Cross meaning all that went wrong, he got it right for us, writing. Consider that also. Thank you for listening. I hope this was helpful. Tomorrow at about 1 or 2, I'll be doing the Sinhala version of this. Tell your friends. Please send this to others also, especially 244, 245, 246 critical.